My name is Jillian Gifford. I'm a certified orthotist, and today I'm going to be walking you through the procedures for casting a custom thermoplastic wrist-hand orthosis. First, we're going to go over the supplies that you need to bring. Your instructor should have given you a measurement form, so please bring that with you. But besides the measurement form, you're also going to need a rubber casting bowl with a liner, at least one roll of 4-inch elastic plaster bandage, at least one roll of rigid 4-inch elastic plaster bandage, a jar of petroleum jelly, a towel to keep your patient clean. You'll also need an ml gauge for measuring your patient, a cut tube or a cut strip, your tape measure, a roll of vinyl tape, your goniometer, an indelible pencil, a pair of bandage scissors, synthetic or vinyl gloves, and lastly, your cast saw. At this point, you should have received a case study from one of your instructors. Be sure that with your patient, you do a thorough patient history, manual muscle testing, and passive and active range of motion as appropriate for your patient. And once you've done those things, then you can go ahead and we encourage you to practice functional position on your patient before you start casting. Functional position is defined as 20 to 30 degrees extension at the wrist, prehensile opposition of the thumb to the first finger, no ulnar or radial deviation at the wrist, as well as 45 degrees, and 10 degrees flexion of the metacarpophalangeal, proximal interphalangeal, and distal interphalangeal joints. So be sure to go ahead and practice that with your patient. And again, I encourage you to preset your goniometer to 20 to 30 degrees. I'm going to use 30 degrees, so I know I'm at the top of the range. Align that with the anatomical wrist joint of your patient, making sure that both arms of the goniometer are in midline with the shafts of the bones of the forearms and the wrist. So that looks about there. Once you're confident that you have that, again, go ahead and practice on your patient. And once you're confident that you can achieve functional position when you're casting, you can go ahead and start preparing for your cast. You'll need 2 lengths of stockinette, which you should have measured out on your patient from the elbow to about 6 inches past the end of the wrist. And go ahead and cut a slit about 6 or 7 inches down from the edge of that stockinette. We're going to place 2 layers on your patient, and the slit that you cut is for the patient's thumb. So go ahead and slide those on, making sure their thumb goes in. And the stockinette should extend past the edge of the fingers here. Proceeding with the second stockinette. And make sure to pull those tight and get rid of any wrinkles that you've created. Okay. That looks pretty good. Next, you're going to go ahead and insert the cut strip or the tubing. And you can do this a couple of ways. You can make a couple of holes for the cut strip. You can also insert the cut strip in between the 2 layers of stockinette as well. I'm going to make some holes and insert my cut strip. And what you'll notice when doing this, go ahead and practice functional position again, and you'll notice that that extension of the wrist causes the cut strip to move away from the joint. So what we can also do is secure that down with some of your vinyl tape. And just make sure in doing this that you have it out of the way of the ulnar styloid, because we will be marking the ulnar styloid as a landmark. And that's much better. Okay, from here we can go ahead and start marking our landmarks. I'm going to wet my indelible pencil. And starting proximally, the first thing is the proximal trim line of the brace. So we're going to have our patient fully flex the arm, and where the bicep meets the forearm, the bicipital eminence, we're going to make a mark there. And that is going to be the basis for our proximal trim line. The proximal trim line should be a 1/2 inch distal from where the biceps meet the forearm. Also mark your ulnar styloid. Moving on to the thumb, we're going to get our first metacarpal phalangeal joint, as well as our first and fifth MCPs. The last landmark we're going to get is the palmar crease. So having the patient flex the fingers down, you can note where that palmar crease is and make a mark there as well. Okay, that's all the landmarks that we have to make for this particular device. So we're going to move on to measurements. I'm going to take all the ml measurements first. You can go ahead and relax your wrist. The first ml we're going to take is at the MCPs. That's 3.5 inches. Moving on to the wrist, 2.5 inches. And then we'll take another at the proximal edge of the brace, which is 3 3/4 inches. We're also going to take circumference measurements at all of those same places. So again, a circumference measurement. And these you want to try to do underneath the cut strip, not over the cut strip. That'll distort your circumference measurement. So at the level of the metacarpal phalangeal joints, 9 1/4 inches. At the wrist, 7 3/4 inches. And at the proximal trim line, 13 inches. You want to make sure on those to not pull too tightly and distort any tissue. And once you have all of your measurements, your cut strip is in place, we're ready to begin casting. At this point, you should grab your instructor and make sure that you've checked out with them before you go ahead and start wrapping with your plaster cast. Now that we're ready to begin casting, the first thing that you need to do is Vaseline the patient's thumb as a lubricant or a separator because the stockinette does not cover the patient's thumb. So using the petroleum jelly, we're going to apply an ample amount all over the patient's thumb. And that will allow for easy removal of the cast. Okay. Then we're going to start with our elastic plaster bandage. So go ahead, make sure you're holding the end, fully submerge that into your water. Squeezing out any extra that you have, making sure that the water's throughout the entire plaster bandage roll. And we're going to start distally and wrap proximally. We're starting just distal to the metacarpal phalangeal joints, keeping in mind where your cut strip is and that remains in a secure position. We are including the thumb in this wrap, so make sure that you wrap around the borders of the thumb and do as best you can to keep that wrap distal to the metacarpal phalangeal joint. So again, wrapping proximally, making sure that you encompass your trim lines. And we're going to try not to make this wrap any more than 2 layers thick. We're not going to pull too tight because we don't want our wrap to cause any roping on the patient's soft tissue. Okay. And we're briefly going to massage this in and move right on to our rigid plaster wrap. Okay. So again, with the rigid plaster wrap into the water, massaging that and squeezing out any extra water. Again, starting distally and wrapping proximal. Including the patient's thumb. Okay. Making sure to include the proximal trim line. And if you have extra, as I do here, please feel free to use your bandage scissors and cut the extra off and then just discard the remaining. So now we're going to massage this in, making sure to keep our cut strip straight, emphasizing any anatomical landmarks that we really want to show. And now is a good time. I've pre-cut a splint out of our rigid plaster. It's about 4 layers thick and has a hole in the center for the patient's thumb. I'm going to wet this. This splint is going to be used to make sure we have good contact on the patient's web space. So again, we'll just slide this in, making sure that the web space is completely covered and massaging that in. And going back and making sure that we're keeping functional position. Hands will be moving the entire time. So again, focusing, making sure to massage the palmar arch. We want to make sure that the entire palmar arch and area is maintained. The thumb in the web space. The thumb is in opposition to the first finger. And we have about 20 to 30 degrees extension here. And you should have practiced this beforehand to make sure that you and your patient know where that position is. So be sure to hold functional position and massage the cast the entire time until your cast and the plaster has hardened. This may take about 5 minutes. Now that your cast has fully dried, we're going to go ahead and start to cut it off. Using your indelible pencil, make a line down the length of the cut tube, as well as perpendicular hash marks so we can go ahead and line it back up later once it's been cut off. Before you use your cast saw, make sure to explain the safety of the cast saw to the patient. Use your thumb as a depth gauge and don't drag the cast saw down the cut tube. Go ahead and make pressing motions in increments all the way down the cast. I'm going to go ahead and turn the cast saw on. And as you saw, you may have to go back to any spots where the cast saw didn't get completely through. All right, at this point, you can also use your bandage scissors to get through any material that's left over. Always using the safety edge towards the edge that's near your patient. Okay. If your cast has really hardened, you may need to use your cast spreaders to go ahead and spread the cast away from the patient. Go ahead and remove your cut strip. Again, any stockinette that hasn't been cut, using your bandage scissors, go ahead and cut through the stockinette now that the opening of the cast has spread. Okay, all the way down the length of the arm. Okay, when removing the cast, the thumb is typically difficult and may get stuck, so encourage your patient to wiggle the thumb when you're removing. Thank you. And now you can go ahead, lining up your hash marks, inspect the cast for functional position. Make sure on the inside of the cast that your marks have transferred. And go ahead and be sure to write your name, the patient's name, and the date on your cast. At this point, we're ready for the next step, and the next step would be modification.